Thanks for coming. My name is Lawrence. I'm the Associate Dean, Outreach and Engagement of the Faculty of Education here at Hong Kong U. And so today marks the beginning of our series of seminars as a part of celebration to our 40th anniversary. So we have a very long history, although we're celebrating 40th anniversary, but we have been in business since 1917, when we were a small department under the Faculty of Arts. And then in, I think, 1972 or 1974, we became the School of Education. And 1984, we became formally the Faculty of Education. So if you count it, it's 40 years already. So, so once again, thank you very much. And we are, of course, it's a big thing, 40 years. And we are celebrating this with a lot of events this year. We have, earlier this year, we have hiking. So we have a bunch of people hiked to the peak as the kickoff of the celebration series. And this series of seminars is another one, important one. And we are inviting all our colleagues within the Faculty of Education to deliver seminars. And we try to aim at a very large audience, covering a very broad area, because our colleagues, our staff actually covers a very high, wide range of areas, including, of course, speech and hearing sciences, early childhood education, higher education and comparative education, language teaching, and everything. So, again, thank you for joining us. I have a little cheat sheet here, so hopefully I don't forget anything important. So early childhood, international, comparative, and information technology. So, so today we are very honored to have Professor Anthony Kong to kick off the seminar series with a presentation titled "From Past to Present: The Evolution of Speech-Language Pathology Education Speech Pathology Education and Practice in Hong Kong." So Anthony is going to walk through the past, the stories of SLP training education in Hong Kong and neighboring places. And I'm sorry to inform you that our Dean, Professor Yang, is not able to make it today, but I'm happy to stand here in front of you on his behalf and welcoming you and thanking all of your participation and support to the faculty. So let me introduce Anthony a little bit more. Professor Anthony Kong is our graduate. He graduated with a PhD degree from Hong Kong U in 2006, and then he joined the Department of Communication Sciences and Disorders at the University of Central Florida, and he came back to Hong Kong and joined us in 2009. 21. Okay, well, his information is more accurate, obviously. Anthony currently serves as the head of the academic unit of the Human Communication Learning and Development, HCLD, and he is also the director of Aphasia Research and Therapy Laboratory, ART Lab, at the University of Hong Kong. He is a fellow of the American Speech Language and Hearing Association, ASHA, which is probably the most well-known for SLP, and the Academy of Aphasia. Professor Kong was the founding editor-in-chief of Cogent Gerontology, which is Taylor and Francis, and was elected as the vice chairperson of the Hong Kong AST, Hong Kong Association of Speech Therapists, during 2004 and 2007. Okay. Throughout his career, Anthony has made significant contributions to the field of physiology by developing many language and cognitive tools for clinical assessment and use for particularly for the Chinese speakers. I hope I'm not missing anything. So without further ado, let us begin our seminar series and delve into the fascinating world of speech-language pathology. Thank you.
All right, thank you very much, Lawrence, for the introduction. And let me once again welcome everybody here in person and also participants online. I'm so honored to be able to kick off this seminar series, and it's really a very good opportunity for us to do some knowledge exchange about speech-language pathology and its practice in Hong Kong. Because up till now, although we have several programs in Hong Kong, training students in our field, not everyone actually understand what we do. And I want to really take this opportunity to kind of use some layman terms to kind of walk you through the history of our evolution, both from the perspective of education, obviously, and also our practice. So here's what all right, so this is what we have prepared for you. Let's see, audio said I'm experiencing severe echo issues. All right, so I'll ask our IT team to help. But here's today's roadmap. I have kind of prepared some content on why speech-language pathology matters, and also talks a little bit about the early days of SLP, speech-language pathology in Hong Kong, some of the challenges that we had in the past, and also opportunities that we have that kind of shape what we are now. We'll talk about some current states of SLP services in Hong Kong, and also how we are providing some support to the GBA or the Greater Bay Area regions in mainland China. So for those who are not familiar with speech-language pathology, this is a kind of educational slide that I took from the Hong Kong Association of Speech Therapists. As you can tell, SLPs are clinicians. They can include professors, they can include managers, they can include researchers, then they can also include professionals working in different settings. And we basically work with people from with all ages, with speech, language, hearing, communication, swallowing, voice, problems, and so on. And one of our goals is really to improve the quality of life of our patients who have these communication disorders. And we work very closely with caregivers, parents, and other professionals. So that is why it is not uncommon that you find speech-language pathologists, in a lot of different places in Hong Kong. So this is another slide that I want to kind of give you a little bit more information as to what type of communication disorders that we deal with. You can see from speech sound errors to language-related problems to voice, swallowing problems, and all the way to some other expressive and receptive communication problems. So it's a really wide range of disorders when it comes to SLP. And another slide that I took from the Hong Kong Institute of Speech Therapists, you'll see that we have a wide range of places that we have people practicing speech pathology in Hong Kong, including hospitals, schools, preschool centers, nursing homes, daycare centers, community rehab centers, private practice, university clinics, and also some government departments. So there are obviously some good impact of SLP services. For example, it can improve people's communication skills, and that is why when we see our clients and we provide proper intervention to clients with communication problems, it will probably lead to some better relationship and social interactions. And in some cases, especially in pediatric cases, a better academic performance of our clients. It can obviously increase the confidence and self-esteem level of our clients, because with better communication skills, it actually encourages and engage our clients to be more fully participating in various types of social activities. It can obviously enhance our quality of life, as we just mentioned at the beginning. And depending on the type of clients, for pediatric or child cases, we have probably some good impact on the client's academic performance. But for adult clients like stroke patients or young patients with brain injury, it will probably enhance their employment reintegration rate and also their social reintegration. And with better communication skills, we'll also expect our clients to have better emotional well-being. And finally, with better social connections and relationship, the actual interaction and relationships with between the persons with communication problems and their family members, friends, peers, as well as colleagues will also enhance. So you can see we have we're doing really important thing for our clients. So a little bit history about the early days of speech-language pathology in Hong Kong. Compared to other allied health professionals, we are still relatively recent in terms of our history. But when we really want to kind of trace back, we officially had our first speech-language pathologist back in the 1960s. But at that time, it was only one ST serving the whole Hong Kong. And about 20 years later, with fewer than 20 speech therapists in Hong Kong, the Hong Kong Association of Speech Therapists, or HKAST, was established. And of course, they have taken very important roles in terms of setting standards, promoting professional development, and advocating for the profession. So here's another slide that you will find all the HKAST objectives. So in case you're interested in this, feel free to go on to their website and read more about their objectives. Actually, we have several HKAST members here today in our audience as well. So feel free to, at the end of the talk or this sharing, feel free to talk to them if you're interested to know more about AST. And I got this figure very recently from the chairperson of the HAST, and we now have about a little more than 1,000 full members in Hong Kong. And if my understanding is correct, this represents about 50% of the actual whole body of the practicing speech therapists in Hong Kong. So we have about 2,000 something speech therapists practicing in Hong Kong at the moment. And there are some important milestones in the development of SLP. If you want to kind of compare where we were to, compare it to the Western world, we know that for the American, Speech Pathology Association, they had this profession formally formed in around mid-1920s, and it was first formed as the American Academy of Speech Correction in 1925, and later become the ASHA, which is the most well-known international organization representing, and also talks a little bit about the early days of SLP, speech-language pathology in Hong Kong, some of the challenges that we had in the past, and also opportunities that we have that kind of shape what we are now. We'll talk about some current states of SLP services in Hong Kong, and also how we are providing some support to the GBA or the Greater Bay Area regions in mainland China. So for those who are not familiar with speech-language pathology, this is a kind of educational slide that I took from the Hong Kong Association of Speech Therapists. As you can tell, SLPs are clinicians. They can include professors, they can include managers, they can include researchers, then they can also include professionals working in different settings. And we basically work with people from with all ages, with speech, language, hearing, communication, swallowing, voice, problems, and so on. And one of our goals is really to improve the quality of life of our patients who have these communication disorders. And we work very closely with caregivers, parents, and other professionals. So that is why it is not uncommon that you find speech-language pathologists, in a lot of different places in Hong Kong. So this is another slide that I want to kind of give you a little bit more information as to what type of communication disorders that we deal with. You can see from speech sound errors to language-related problems to voice, swallowing problems, and all the way to some other expressive and receptive communication problems. So it's a really wide range of disorders when it comes to SLP. And another slide that I took from the Hong Kong Institute of Speech Therapists, you'll see that we have a wide range of places that we have people practicing speech pathology in Hong Kong, including hospitals, schools, preschool centers, nursing homes, daycare centers, community rehab centers, private practice, university clinics, and also some government departments. So there are obviously some good impact of SLP services. For example, it can improve people's communication skills, and that is why when we see our clients and we provide proper intervention to clients with communication problems, it will probably lead to some better relationship and social interactions, and in some cases, especially in pediatric cases, better academic performance of our clients. It can obviously increase the confidence and self-esteem level of our clients, because with better communication skills, it actually encourages and engage our clients to be more fully participating in various types of social activities. It can obviously enhance our quality of life, as we just mentioned at the beginning. And depending on the type of clients, for pediatric or child cases, we have probably some good impact on the client's academic performance. But for adult clients like stroke patients or young patients with brain injury, it will probably enhance their employment reintegration rate and also their social reintegration. And with better communication skills, we'll also expect our client to have better emotional well-being. And finally, with better social connections and relationship, the actual interaction and relationships with between the persons with communication problems and their family members, friends, peers, as well as colleagues will also enhance. So you can see we have we're doing really important thing for our clients. So a little bit history about the early days of speech-language pathology in Hong Kong. Compared to other allied health professionals, we are still relatively recent in terms of our history. But when we really want to kind of trace back, we officially had our first speech-language pathologist back in the 1960s. But at that time, there was only one ST serving the whole Hong Kong. And about 20 years later, with fewer than 20 speech therapists in Hong Kong, the Hong Kong Association of Speech Therapists, or HKAST, was established. And of course, they have taken very important roles in terms of setting standards, promoting professional development, and advocating for the profession. So here's another slide that you will find all the HKAST objectives. So in case you're interested in this, feel free to go on to their website and read more about their objectives. Actually, we have several HKAST members here today in our audience as well. So feel free to, at the end of the talk or this sharing, feel free to talk to them if you're interested to know more about AST. And I got this figure very recently from the chairperson of the HAST, and we now have about a little more than 1,000 full members in Hong Kong. And if my understanding is correct, this represents about 50% of the actual whole body of the practicing speech therapists in Hong Kong. So we have about 2,000 something speech therapists practicing in Hong Kong at the moment. And there are some important milestones in the development of SLP. If you want to kind of compare where we were compare it to the Western world, we know that for the American Speech Pathology Association, they had this profession formally formed in around mid-1920s, and it was first formed as the American Academy of Speech Correction in 1925, and later become the ASHA, which is the most well-known international organization representing speech-language pathology worldwide. And the development of the Hong Kong kind of speech-language pathology was more based on the UK model or the British model, which was related to the Royal College of SLTs. And there was very little in the way of SLP provision and no formal education of SLP in Hong Kong until the early 1960s. So the establishment of speech-language therapy service at the Yamade Polytechnic kind of prompt the government Department of Education to send out some certain personnel with a background in teacher education to train SLP in the UK, and then the returning graduates with the qualification become the specialist practicing in Hong Kong, and they were given further training in the education speech therapy at the Hong Kong College of Education. Again, this was like long time ago. And then by the 1980s, in order to meet the actual increasing need of and demand of the medical as well as non-medical services, the pre-1997 Hong Kong government initiated a new overseas training program. And that is when they started to use this scheme to send students from Hong Kong to overseas and get training, and then they come back to Hong Kong and develop the local SLP services. And as you can see, between 1985 and 1990, we have produced about 25 graduates because of this scheme. And these candidates, when they returned, were offered positions either in medical or health department, education department, or some NGOs. And those are really, important foundations as to the development of our profession in Hong Kong. And it also later broadened our service and expertise that will lead to the very first SLP training program in Hong Kong U. So the development of the SLP education is, can be traced back in the late 1980s, and that was when we were consider ourselves as the new era in the local SLP profession. And the educational program installed at Hong Kong U in 1989 were the first to provide professional qualifications locally rather than sending students abroad. And that was the first official UGC-funded undergrad program, which was 4 years in total, which is quite different from the 3 years traditional program. And the new department of SHS, or back then we call it the Speech and Hearing Sciences, was actually located not on campus, but on the Prince Philip Dental Hospital instead. So we actually were very good neighbors with the dental department or dental faculty. And then we happily lived there for 25 years until around 2014, where we have a major plan to kind of relocate ourselves back to the main campus. And over the years, of course, our SHS program has a steady growth in terms of the size as well as the scale of our teaching staff and students, as well as the diversity of our professionals. So we had multinational. Okay, so let's kind of move on to some current states of SLP services in Hong Kong. And I have kind of summarized what I've observed over the years in terms of what we have done so far to allow people to understand better our role in Hong Kong. Obviously, there is a growth of SLP services. There is an expansion of different services in Hong Kong over the years. And with some of the initiatives that we had years ago and also still continuing, we feel that there is an increased awareness of communication disorders and communication sciences. And also, because of this growing awareness, we were able to see better opportunities for the development of SLP. On top of that, we have, over the years, significantly collaborated with many multidisciplinary teams. And a lot of these opportunities of collaborations with maybe healthcare professionals, maybe with educators, maybe with researchers of related disciplines, actually contributed to the growth of the SLP services in the community. And we also, because of these collaborations, we had a better understanding of how to address the needs of individuals with different types of communication disorders. Obviously, thanks to the advancement in technology, We have provided opportunities to enhance our SLP education as well as practice with the use of the improving technology. So the impact of digital tools, telepractice, assistive device, and so on definitely help the delivery of SLP services. And that was actually very important at the time when we had COVID. On top of all this, we also feel that there is an improved access to service in general, probably due to the enhanced awareness, maybe some of the changes or updates of the policy. We are now seeing better opportunities for improved access to SLP services, including underserved populations. And there are different types of service delivery models like clinic-based, school-based, community-based services, and so on. And from time to time, we're seeing new funding opportunities that kind of shape even better the actual coverage of these services in Hong Kong. And you can also see that there are more and more specialized clinics and centers in Hong Kong around different regions, including key clinics, hospitals, or centers or NGOs in Hong Kong, kind of offering SLP services. So this really includes a wider range of assessment, therapy, as well as counseling. And just a little bit, a while ago, I mentioned about the accredited register scheme. And I think this also kind of helped raise the professional recognition of our profession, because we are now actually playing a more important role in a lot of the policies or daily practice guidelines. And in turn, it have a better impact on healthcare, because the SLP education as well as practice in Hong Kong contribute overall to the overall healthcare landscape in Hong Kong. And it is really important that we address the communication disorders and improve the quality of life of our clients. So let me share with you some maybe latest advancement in SLP education as well as practice. We mentioned about the technology advancement, so the technological integration is obviously part of it. For example, Hong Kong U has been using a lot of technology in terms of the simulation, the virtual reality, and over time we have used telepractice as well as the mobile application for our speech-language pathology, so a lot of technology-based kind of ideas. And we are also using digital platforms instead of just the traditional face-to-face platform for assessment, intervention, as well as the data collection to enhance service effectiveness and efficacy. And as a university-based kind of stakeholder, of course, we have been playing a very active role in the research and evidence-based practice in Hong Kong by integrating the latest research findings and best practice into our SLP training program and clinical protocols. So overall, this will lead to very good, high quality and effective interventions for local clients. We also mentioned about the multidisciplinary kind of collaboration. So this interdisciplinary collaborations with a lot of joint initiatives and projects really help the expertise of multiple disciplines to merge together and to address more complex communication needs for some of our clients. And obviously, different part of the team, SLPs, educators, researchers, other healthcare professionals are working very closely to provide a more holistic care of communication disorders. And compared to the US or some other related kind of closely similar countries in Asia, Hong Kong is a very culturally diverse place. So it's really encouraging to see that we are actually recognizing the competence of SLP practice in a more diverse and a more multicultural society here locally. So finally, let me just maybe give you a few kind of ideas about how the SLP services that we have locally in Hong Kong or at Hong Kong U can kind of lead to maybe some opportunities in the GBA regions as well as the mainland China area. First of all, we all know that there is a lack of specifically trained SLP program in mainland. And there's a large amount of Chinese dialects and subdialects in mainland China, making it significantly more challenging to provide linguistically specific intervention to clients. So right now, a lot of these services are actually provided by other professionals instead of professionally trained SLPs in mainland. And in the early 1996, our former unit head or our former department chair, Professor Paul Fletcher, who has retired, began making contacts with all these Chinese academics. So back then it was not a new, back then it was a new thing. But he was really the pioneer who kind of started all these collaborations. And for now, we actually have a lot of kind of different initiatives at Hong Kong U, including some mainland engagement opportunities, experiential learning in a Chinese media environment type of project. We have summer China placement for our students. We also have community outreach programs and advocacy efforts that kind of promote the interaction between clients as well as healthcare professionals in Hong Kong and in mainland China. So overall, I think I was able to give you a brief overview of the several decades of development of SLP in Hong Kong. And here I have put in some useful links that may be of interest to you guys. So right now, I think that's it for me to share today, and I assume we will have a lot of questions or interactions from either here or from participants online.
Okay. Thank you, Anthony. Thank you for so much information. And now we kind of get a picture of how SLP is developed in Hong Kong, starting from having only one SLP for the entire Hong Kong back 60s.
Yes.
And then with the scheme organized by the Hong Kong government, setting out some 25 people within 5 years. And anyway, so now I would like to open the time on the floor to questions from the floor here, as well as online. This is a sharing, kind of casual seminar, so please feel free to ask Anthony any question.
Or if you have ideas or things that you think I've missed that you really want to share with others, that would be great.
Well, it's always, it's not easy to start because people are shy. So maybe I'll start with one simple question.
Sure.
One of the most common questions that I receive over the years of being a teacher in speech language pathology is why in some schools SLP belongs to the Faculty of Arts, and in some schools it belongs to the Faculty of Education, and some even in Faculty of Nursing and Allied Health. So what do you think, why is it the case, and where should we belong to?
Well, I think that's a very difficult but good question, because when you look at the type of disorders that we work on, and the different types of settings that you can find speech language pathologists, you probably realize that we are experts in many different areas: linguistics, education, medical science, psychology, and so on. So actually, our discipline will fit well into any of these, bigger kind of faculty. My understanding is, a lot of the time, this type of arrangement was not determined by the program itself. It's more about the resource allocation when a new SLP program is established within a particular university. So in the case of, like, for example, in our case, we are under education, but we have colleagues collaborating very extensively with medical school. And then at the Polytechnic University, which under the linguistic department or faculty of art or social sciences in general, I think, right?
Humanities.
Humanities, thank you. Again, they have collaborations with a lot of different other disciplines, both within PolyU as well as outside of PolyU. So I think yes, the identity is important. But at the same time, I think it's really about the composition of the SLP program and what our interest in and how we kind of extend all these different opportunities with other collaborators.
So really, it's no correct answer to that.
I don't
So
think. Well,
I guess it also depends on the history of that department. For us,
Yes.
we came from the School of Education, right? So and that's why logically we are under Faculty of Education. So yeah, thank you. Still no question from you guys, so maybe I'll go on with my many questions. Okay, now thank you. You have provided a very clear picture of the history of our evolution. Seeing that now we are kind of quite successful in the SLP context compared to back in the 60s. Now looking at the mainland China, as you said, there is no formal training for STs, and a lot of the ST clientele are managed by other disciplines, like OTs, nurses, and so on. So how do you think we can help them develop ST discipline?
Thank you for that question. I think we have a very important role to play. Apart from the knowledge sharing and collaboration, I think there are kind of some more important kind of tasks that we may consider. For example, training and education. We can actually be someone to take the lead to provide professional training, high quality education, or even maybe start by some exchange programs, training initiatives to start the collaboration. Setting standards and guidelines, I think that's another important big thing that maybe a lot of current practitioners in mainland China find it difficult because they just don't know what to follow. Also increasing the access to services because based on my understanding right now, although mainland China is an aging country similar to a lot of the Asian countries worldwide, the emphasis of speech pathology is still at the pediatric population because parents see the values of investing the time and money and effort in providing training to a child case with communication disorders or needs. But that's not necessarily the same for our elderly counterparts, such as those with dementia, those with stroke, those with traumatic brain injury. So I think all of this really are some of the things that we can contribute and support.
Yeah.
Nirmala?
Yeah.
Thank you.
Thank you. I have a couple of comments. As someone just comments. First of all, as someone who was here when this program was established at the university, it's absolutely wonderful to see how it's evolved. And Zubrit was brought here, and I was actually at the university at Senate when it was decided to put this in Faculty of Education versus Medicine. So it's just congratulations to the department to coming this far. And also congratulations to the profession, because what is very, very clear is we've seen increasing professionalization from society-based registration. This is very, very important for us as an educational institution. And you talked about the elderly voucher scheme and how it can be encashed, right, by visiting a speech therapist. But I would like to offer one or two just comments of what I see the way forward. What I see is that we are experiencing dramatic demographic changes. So Anthony himself mentioned about the elderly voucher. People are living longer. They're more likely to have stroke. They're more likely to need speech therapists, okay? So that is definitely in the elderly realm. People are living till, like Hong Kong has the highest life expectancy in the world, 87 something. So we're gonna see more need for speech therapists, swallowing specialists, because this is. But the second area that we're also seeing, and this is not because of our work, but this is because of societal change, is younger children being born with special needs. The period of before children before 27 weeks were not born, they weren't viable. Now children, medical technology has improved so much. So we are seeing actually, my colleagues tell me in a K1 class, we're seeing so many children with special needs. So this is a big need now with the young children. The third thing we're seeing, this is just comments, okay? I would love to hear a reaction, is COVID. COVID has dramatically influenced our kids who are starting school now because they did not have the interaction. Because it's all about what we talk with, serve and return. It's all about turn taking. And they do not, if they have quiet parents, they were isolated, they do not have. And my last comment, and you can tell me if I'm wrong, my last comment is what I think we will see in speech pathology, I may be wrong, is a focus. Now we've been focusing in Hong Kong on access, getting more speech therapists, increasing duration. We're now going to see the focus on quality much more.
Absolutely, I think you're absolutely right. Because the change of the societal needs, the advancement of all the medical technology, the increase in life expectancy, all these factors actually create opportunities for SLP to further develop. I think these are excellent points. And it all of these points echo very well with the content that I presented as well.
Yeah, I also agree with you, but I can share with you one of my previous experience about working in China. I was invited to, my area is laryngectomy. This is a population of patients with their vocal cords removed, leaving a hole in front of the neck, not able to speak because of the vocal cords are gone. So I was invited to give a talk and some hands-on demonstration of how to teach them how to speak again. So that was in Hunan, Changsha, Hunan. And I am fluent in Mandarin, but I still have very hard time managing the patient because he did not speak any, Putonghua. He speaks his dialect, and there's no way I could understand him. So I think the point I want to make is language is a very important thing to deal with, especially when we want to nurture SLTs and SLPs in China, because that's a barrier for us to spread the culture of SLP in China. So all the way from the tests to the protocols to the skills, we have to manage well. So it's the linguistic diversity as well as the cultural diversity. So especially when we're talking about swallowing, the diet thing, the diet modification, I'm sure it's different. They have very spicy food compared to Hong Kong. Now, I don't know if spicy food can enhance or facilitate swallowing. So a lot of things needs to be done probably in collaboration with mainland scholars. So thank you.
Do we have some comments?
Yes. Actually, we were discussing about mainland China, but I always see that apart from mainland China, because Hong Kong speaking tonal languages, we speak Cantonese, which is a tonal language. And in Asia, in Southeast Asia, there's also some other countries that the speech therapy service is really under the surface, just like Vietnam and Thai. So I think we are not just looking for China, but we can also look for some other countries like Thai, Vietnam, and some other tonal language countries. And the other comment is we should look back to Hong Kong locally. This is the 40 years of the Faculty of Education, and we can imagine that the SLP professional in Hong Kong is about 40 years or more. But what about the other 40 years? What we should be focused? This is not a question, but if you have any comments, you're welcome to discuss. But from my perspective, I have been practicing for SLP for about 17 years. What I observe here is the SLP in Hong Kong is quite general. We are general SLP. So if you want to specialize in one area, you probably pursue a PhD or some other further study, or you claim yourself as an expertise. But I'm not sure, but maybe the other 40 years, maybe we can go for this direction. It's just like we try to develop some system for helping the SLP to find their expertise. Of course, we keep the general practice, and we also have the specialty expertise. I think this will be maybe another 40 years that we can, yeah.
This is actually something ASHA has been doing for some time. Even though they have a long history, they still don't have an expert certification for each of the disorders, all the big 9 areas in SLP. My understanding is they also have challenges when establishing this type of so-called expertise certification. Because first of all, what is expert enough? That's one thing. And also, it really depends on how potential participants or potential SLPs are like really serious about this idea. Because for some SLPs, they're working in a particular setting. They're using their expertise on a daily basis. They already feel very okay with it. And they also have their CEU system, which is already a lot of work for them. So taking on an additional certification process can be, an extra demand. But I think these are good ideas.
Hello, I'm an overseas member from the Hong Kong AST, and I'm quite interested in, so if people coming from overseas back in Hong Kong and assume that the educational degree itself has included linguistic education to education for due to multilingual act like nature of Hong Kong, it probably either really included. However, for people coming back into Hong Kong, how do they bridge the gap into understanding that language and using different assessment that came in different language, while as majority of where I came from probably only speak English as the only language.
Currently, we also have some overseas trained STs who would like to, who's come to Hong Kong and would like to practice in Hong Kong. I think that's considered by the Hong Kong IST
Yes.
on an individual basis.
Mhm.
So they have to look at your credentials and documents.
Yes. So they need to actually evaluate your credentials, look at where you obtain your degree is comparable to what our standard is in Hong Kong, and if something's missing, the IST will provide individual kind of recommendation as to how you can get this particular component in order to fulfill the criteria. So it's a really individual-based type of evaluation, and different candidates may have different needs and may have different situations. But there's this opportunity for
It's
sure.
possible. Yeah, it's doable. So, all right. So, any other questions from the floor? Comments? Yes.
So thank you for your speech. Actually, I'm a student in high school currently that is interested in pursuing SLP, and I was wondering maybe what characteristics do you think of an SLP that are less talked about that maybe Hong Kong youth seeks?
I think an excellent SLP should have a lot of good characteristics. Being open to communication, have patience, and also have a caring heart. I think those are the 3 important things. But on top of that, you need to be hardworking because it's not an easy discipline. You need to learn a lot in 5 years. Not to mention, let's say, if you want to pursue a master's level in other institutes, it's 2 or 2.5 years journey. So it's a very kind of long process if you were to study at Hong Kong U. And also, I think being open to the diverse culture and the things that we have been discussing about the actual change of our clients' needs should be something you consider as well. So it's really it's kind of a range of characteristics that we look for. Maybe Lawrence can also add more.
Yeah. So basically, talkative, outgoing, and hardworking.
Talkative in a good way.
Yeah, talkative in a good way. So, because some of the students that we have seen who are not that happy is because they are not really that outspoken. Okay, so being able to enjoy conversations with the others and openness to new things, because after all, this is not a typical subject in your high school. But of course, we do have some foundational information like anatomy and physiology, acoustics, linguistics, statistics, all those foundational courses, plus quite ST related, like phonological development and so on. But those are, those you can work out, but some of the attributes of STs are more important than the others. I mean, like being able to possess a very good people skill, problem-solving skills, and etc. So, yeah. But after all, it's a very fascinating career. I want to add this: AI cannot replace ST. So, I'm sorry to say that, but if you look at a lot of professions, people are kind of wondering nowadays whether they can be replaced by AI. But I can tell you for sure, STs cannot be replaced by AI, not at all. Okay.
Yes, that's a very excellent point.
So, any other questions?
Do we have anything from the people from? Okay,
Nothing. They are very happy with what we are talking here. So now I see the time is almost 3:30. I think that.
One last.
Okay,
Yeah, one more question. Yeah.
Going back to multi-language, and I'm understanding we're trying to bridge a gap with the service in mainland China. A lot of the languages assessments are quite standardized outside, and I would assume having dialect would be added challenge to that. What's the challenges on top of speaking, like collaborating with different scholars to do that? What other challenges would be there to be able to provide service as if they are using one standardized assessment but rely on quite the ability of the speech pathologist to be able to tweak it to get the result or representations of how the patient is presenting? What type of things has to be done to help him with that sort of service to be more standardized?
Well, I mean, ASHA as well as some other related professional agency has specific guidelines on how to use interpreters in situation or clinical situation like this. But I think the best solution really is to have the test involved, validated in the local dialect or local language, because that way you will have the linguistically sensitive norms to make the comparison, and you will have the baseline that is more valid to come up with your clinical diagnosis. Otherwise, I mean, if yes, you can still make use of the interpreter or someone who can speak the language to help with the conduction of the test or interpretation of the results. But relying on the irrelevant norms to come up with the final diagnosis is still problematic.
I can give you an example using Maddie's area. Stuttering. I mean, stuttering in English has been done and very well developed. But for Chinese, no, we still do not have a right? We still don't have a standardized test for Mandarin or Cantonese. So if we are to practice in that area, it will be very, very difficult and not ideal to just borrow the English and translate it by the interpreter. So that's one of the scenario that we are facing.
And it's actually we're not alone in this particular situation, because a lot of non-English countries or regions are facing the same thing. So we have a lot of peers to kind of provide the support and kind of work out the this challenge together.
Thank you. Any other questions? And still nothing from the online audience. So I guess we are very happy with what Anthony is providing us. So let me once again thank you, Professor Kong, for the wonderful information. And thank you for the audience, and this concludes our seminar today. So thank you for coming.